Hi guys, so glad to have you back. This is James at sleepplay.com. We appreciate you guys for subscribing. We hit that 10,000 mark. We're excited. We have much more videos to come. Stay tuned. Today we'll be discussing sleep apnea and high blood pressure, okay? These two subjects are very close in relation. They almost go hand in hand. Where one is, they're sure to find the other one, okay? And some say they coexist actually. And so there's a couple forms of sleep apnea that we'll be discussing today: obstructive sleep apnea, or OSA, and CSA, which is central sleep apnea, okay? So the first form of sleep apnea we'll be discussing today is OSA, or obstructive sleep apnea, okay? And so a couple factors or reasons for obstructive sleep apnea may be neck circumference, excessive weight gain, or family history, okay? And so when this takes place, the muscles in the airway relax and they close, causing you to stop breathing multiple times a night, okay? And so some things you may notice is choking, gasping throughout the night, or just a common snoring, okay? The next sleep apnea we'll be discussing is CSA, and that's central sleep apnea stands for. And in this sleep apnea, or form of sleep apnea, it's when your brain fails to send signal to the muscles that control your breathing. Central sleep apnea is a less common form of sleep apnea, and actually in some patients they have a combination of both. The severity of sleep apnea obviously plays a role, but whether you stop breathing 10 times or 100 times an hour, the interruption in breathing elevates your blood pressure levels significantly. So high blood pressure left untreated can lead to cardiovascular disease, kidney complications, heart attack, stroke, and diabetes. Every time you stop breathing, you're cutting off the oxygen levels to your brain and your body, and so your heart notices this and it works overtime to try to make up for that oxygen loss, okay? And so this is the reason why the blood pressure levels are rising. So if you suspect that you have sleep apnea, get it treated, because most likely you're going to have high blood pressure down the road if you don't. If you have high blood pressure, it might be a reason to get tested for sleep apnea, because that might be the cause, okay? Either way, you want to make sure you're taking care of yourself. High blood pressure is related closely, as I said in the beginning, to sleep apnea. And so, obviously if you get the sleep apnea corrected, I have seen people who've been on medication for high blood pressure for years, and they were able to get off that medication, with the relief from the CPAP machine, okay? So if you want to know more about high blood pressure or the CPAP and the correlation between both of them, please go on the link below, click on the link, and if you like this video, please like, share, and subscribe, and we'll see you next week.